6:44. Let's get to a story that is all new this morning. An important conversation is about to get underway about Black maternal health. A summit called Hands That Rock the Cradle is bringing together policymakers, advocates, and women to talk about better outcomes for women of color. You have likely heard the statistics before. According to the CDC, Black women are 3 times more likely to die from pregnancy complications than white women. Some advocates say this is the most attention this issue has ever had, and they are hopeful for change. Marcella Robertson has the story.
We're experiencing still a crisis in this country around maternal mortality.
That crisis is one that's personal for Kanika Harris. In 2010, she was pregnant with twins. In her 3rd trimester, doctors diagnosed her with preeclampsia and HELLP syndrome, which sent her into liver failure.
I lost both the twins at 31 weeks. One twin was born stillborn. The other twin passed away 3 days later, really due to a lack of oxygen.
Harris says she knew nothing about preeclampsia, and her doctor never gave her any information about the signs to look for.
And I had all of the signs. I had headache, I had nausea, I had back pain and severe cramping. Had I known the signs and symptoms, I think I would have made it to the hospital a lot sooner. And, those twins probably would have been here today.
That experience led her to the work she does today, advocating for policy change to address maternal disparities with the Black women's health imperative. Harris says the problem needs to be addressed on a deeper level, taking a closer look at access to health care, racism, and bias.
We need policy to push funding and resources in these areas so that we can have a greater impact than just awareness.
Johns Hopkins Center for Health Disparities Solutions is also a part of the conversation about improving outcomes of pregnancy. Experts say part of the problem is providers just aren't listening to Black women.
This problem is not a poverty problem. We have very high-profile cases where women who were very well educated, who had financial means, very famous women, who find themselves in facilities that are not being responsive to their needs.
And this summit this morning, hosted by the Johns Hopkins Center for Health Disparity Solutions, happening from 9:30 to 1:30 today at the Johns Hopkins Bloomberg Center in Northwest. Again, the focus on this conversation today is really getting policies pushed through, like we've talked about, the Momnibus Act, the 13 bills that work to address this crisis that have not yet passed in Congress. So certainly a lot of important conversations happening this morning.
I wanted to ask you, because I know this is an issue that you've been covering for a while now. Until actual laws are in place, what are experts offering advice-wise for moms?
Yeah, I mean, I think the best thing is advocating for yourself, educating yourself and advocating for yourself, and really knowing that you have the right to switch providers. And if something doesn't feel right, or you feel you're not getting the care that you need and deserve, that it's okay to move on and feel that you're empowered to do so.
Right.
So.
Yeah, we just talked about this during the story about this actually happened to us.
Yeah.
Is a physician we went to on the day the baby was born, firstborn, go to the hospital, and they sent us home.
Wow.
And then we come back, and then they're still walking around like it's not a big deal. Fortunately, we were like, it's time. The baby's coming.
Yeah.
And they're like, oh, okay. So
Right.
yeah, you're right. You have to advocate for yourself.
You've gotta
and you have to have
speak
the
up, yeah.
knowledge
Yeah.
to advocate for yourself and know that something's not right.
Yeah, so important conversations
Very,
happening
very important.
this morning for sure.
Yes.
Yeah.